Our pets are very similar to ourselves, and the last few years have been pretty stressful in a number of different ways, in a number of very similar ways to our own lives. They've kind of mirrored our own situation, and anxiety is really on the rise. We're seeing this because of the pandemic puppy situation, where we weren't able to get our puppies out and about, socializing them, which is so important for their mental well-being. We're also seeing it more and more because of breeding and genetics, and certain popular breeds of the moment are becoming notorious for being anxious and requiring a lot of other behavioural intervention. And cats aren't immune either, especially if you have to take them anywhere. This isn't a new situation, but putting your cat in a cage, getting them in the car and taking them to wherever they're going, which is normally either a boarding cattery or the vets, is an incredibly anxious and fearful experience for them. And today I want to dive into all of these problems so that your pet can be happy and living their best life.
Welcome to the Call the Vet Show, the podcast that helps pet parents understand and optimize the health of their furry family so they can live the full and happy life you want for them. And here's your host, veterinarian Dr. Alex Avery.
Hello, kia ora. Welcome to another episode of the Call the Vet Show. It's really great to be joining you for another action-packed, fun-filled episode. This week, or the last kind of couple of weeks, I've been seeing a number of animals that have been really anxious coming to see me at the vet clinic. Now, this is something that clearly, we do get from time to time, but the classic situation of a dog or cat hating the vet, trembling and shaking as they come into the consulting room door, their tail tucked between their legs or refusing to come out of their cat carrier, really is a thing that needs to be consigned to the past. There's so much that we can do to prevent this in the first place being a problem. And then if it is a problem, actually kind of correcting the situation and taking some action to mean that this isn't the case. And that's going to be really important. And I'm going to talk about that today. But it also got me thinking about just general anxiety as a whole, because I think we are seeing this more and more in our pet dogs and cats. There was a whole change in routine that caused all kinds of different problems with people working from home. They've not necessarily gone back to the office, and we weren't able to get out and about, as I said in the introduction. And anxiety, it feels, is really on the increase in our pets. And there's an awful lot of different tools in our arsenal to get to the bottom of this. And so today I really just want to talk about what the underlying causes of anxiety are, because although I've mentioned a few of them already, there are a number of really important ones that you probably won't have considered. And that's going to be important because I'm then going to talk about, what can you give an anxious dog or cat to help ease their anxiety, but how can we reach a diagnosis of what the actual underlying cause is so that we can then actually target the root cause rather than just try and kind of muck around in the periphery, if you like, to reduce the feelings of anxiety, but not taking away that stimulus. And then I do want to touch briefly on just how we can deal with fear, anxiety and stress at the vet clinic. I'm fear-free certified, and this is something that I feel is very strongly about. And I think it's within every pet parent's reach to actually make their pet love their vet. So with all that in mind, let's dive deep into anxiety in our dogs and cats.
And now, on with the show.
So first, the causes of anxiety. Now, the first one is going to be lack of socialization. So here, that's just a lack of experiencing life in general, all the different sights, the sounds, the environments, the experiences, the people, the vehicles, everything that a dog or a cat should be experienced and exposed to in the early stages of life. And here we're talking kind of from about 10 to 16, possibly 20 weeks of age. Their brains are just like little sponges. They just suck everything up, accept it as normal. They develop coping strategies should they come across something new or unfamiliar when they get older. And it's really important that we're intentional. There's a lot of intentionality about the socialization experience that, again, both our dogs and cats are subjected to. We tend to think of it as a dog job, if you like, when you get a puppy, but absolutely cats, it's the same thing. Introducing them to the carry cage, the car, their harness, their collar. If you want to walk your cat, on a lead, then absolutely exposing your kitten to that in the early stages is incredibly important. And if we have a lack of socialization, then that can be catastrophic, because it will generally lead to anxiety, and certainly anxiety of new experiences. It can lead to phobias. So we've got our, firework phobia, for example, or our storm phobias. It can also lead to separation anxiety, which can result in a lot of destruction of property, and they can cause some pretty serious damage to themselves as well. And it can lead to aggression, fear aggression, and other really serious life-limiting problems. And actually, if we take away our infectious diseases that are vaccine preventable, so things like our parvovirus, then actually the biggest cause of death in young dogs is because of behavioural issues that result in many cases from this lack of socialisation. Now, that's not always going to be the case, and actually previous bad experiences can also cause a lot of behavioural issues, and that's the same with anxiety as well. Sometimes it doesn't bear thinking about what's happened to some of our rescue pets, for example, what they've been through in their past. It's really heartbreaking, some stories that, I'm sure you've heard or seen on social media as well. But previous bad experiences absolutely can lead to just a general anxiety, or anxiety in certain specific situations. The big cause of anxiety, and some phobias, and certainly kind of fear and phobias of loud noises is definitely one. But anxiety can be caused by pain, and that's both acute in the short term, but more common situation here is actually chronic pain, so long-term uncontrolled pain. And clearly the biggest culprit here is going to be arthritis. It is an incredibly common problem in both cats and dogs. It's not recognised nearly enough. We're not good as pet parents or as vets either, is actually picking up the early signs of arthritis, our dogs and cats being in the early stages of chronic pain. And we often don't do the best job possible at actually addressing that and treating it using all of the different treatment modalities in our arsenal. We really need to approach it from a number of different aspects. We call that a multimodal approach, where we're tackling weight, we're including weight, diet, supplements, physical therapies, drugs. Clearly, there's a whole range of different things that we can do to help reduce the pain and keep our pets comfortable, and also improve their mental state as a result. And then we've got other medical issues as well. So we've got conditions of older dogs, so dementia, senility, kind of cognitive decline, which is a common problem in older dogs and cats, and is also very underappreciated and under-recognized. Unfortunately, there's not a huge amount that we can do that makes a massive difference, but there are definite steps that we can take to make our dogs and cats' lives a lot easier, happier, less stressful, and less anxious in their senior years if they're going through this mental deterioration. But then any other chronic diseases can also result in anxiety. I'm thinking here allergies, so being itchy all the time. We almost do need to think of that, or we should be thinking of that, as being painful all the time. It is incredibly irritating. It has an incredibly negative impact on quality of life, and frequently results in anxiety. We can also think of hormonal problems, so thyroid problems, Cushing's disease, which is an increase in stress hormone throughout the body, and clearly that is kind of indicating to the body that it's under a lot of stress. You can imagine how much anxiety can be produced as a result of that. So we don't want to think of anxiety as just a behavioural issue, if you like. We really need to consider that there may be something kind of completely seemingly separate that is triggering this anxiety, another medical issue that if we're not addressing properly, if we're not getting to the root cause, how can we hope to properly manage and eliminate that dog or cat's anxiety levels? So that's something that you really should be thinking about if you do recognize that your dog has an anxiety at certain times or all the time, or but you've noticed it increasing and becoming more of a problem than it was ever before. Those are all indications that maybe there's actually more to this than meets the eye. So that's kind of our causes of anxiety. In the short term then, what can we do to help our anxious dog or cat? What can we give them? Now, clearly the behavioral modification that we're going to do depends on what it is that they seem to be anxious towards. So if it's an anxiety towards fireworks or storms, can we be desensitizing them to that through the use of kind of CDs or kind of Spotify playlists is probably the better way to go about it these days, to be gradually ramping up those sound levels to get them used to those loud noises. But what can we give, if you like, in terms of supplements and other kind of common therapies that are going to be appropriate for the vast majority of different anxious dogs or cats, regardless of their particular manifestation? Well, the first one that I always like to talk about is pheromone treatment. So here I'm thinking of dog appeasing pheromone, which comes a product called Adaptil, which comes as either a collar or a plug-in diffuser, much like an air freshener. Or we've got our feline facial pheromone, which is Feliway, which comes in a spray, which is great if you're taking your cat in a cage and they don't particularly like it, or kind of a plug-in air freshener as well. These pheromones, they help our dogs and cats respectively just feel comfortable, feel safe, feel at home in that environment, and they can be incredibly powerful. We've got supplements like Zilkine, which is actually a milk protein, a casein derivative, and that's been proven to help reduce levels of anxiety, and it's a natural product. It's very safe, and it comes in a capsule that you can kind of sprinkle and mix in with food, and is generally very, very readily accepted. We've got products like Carmex, which is a herbal mix, a mix of lots of different herbs that again has been shown to reduce levels of anxiety. From the kind of a non-supplement point of view, we've got our body wraps. The kind of classic original version is a Thunder shirt. So these are very tight wraps that effectively kind of like hug the body, which again make them feel kind of much calmer, much less anxious, and have a really kind of soothing effect. They don't work for every individual, but they can, they can have a dramatic response. If we're stepping things up, we can think of CBD. That there is more and more evidence that CBD has an anti-anxiety effects, and that can be very, very powerful. I've certainly got plenty of content on CBD that I'll leave in the show notes as well, and kind of in the links that I'll link to in the kind of the description down below to this episode. And then we've got our pharmaceuticals. So there's a number of different pharmaceuticals, and clearly they're only going to be given in discussion with your vet based on your pet's clinical history. There are other medical problems that may or may not be known about. The most common one is gabapentin. That can be given with melatonin sometimes, and that's great for targeting specific visits. So actually vet visits, that's a really useful treatment modality. And we can step things up. There's a huge number of different options all the way through to our tricyclic antidepressants. And, we might go, hey, that's, a little bit too much. You might be thinking that that's definitely not something that you'd want to think about, but they can be really valuable especially in our really severely affected individuals, where actually we're using them for really targeted short-term use to just calm our pet, to get them out of this high stress, kind of constantly alert, kind of cortisol driven behavior, to bring them out of that, help them relax, help the body kind of reset, help all of our other strategies that we can use, again, which are going to vary depending on what the specific problem your pet has. It's going to allow those to work, and then, we're not going to need them long term. There are going to be some dogs that will need, and cats that will need longer term medication, and those are often going to be ones that have had some seriously bad experiences in the past, and they actually need this to be living their full and happiest life, which should always be our our guiding light, if you like. We really need to be taking their well-being as the most important thing when we're constructing any care plan, no matter really what we're talking about, but certainly when it comes to anxiety and other behavioral issues. But with that in mind, we also need to be reaching a specific diagnosis. So it might be that we know it's due to a lack of socialization, but are we ruling out pain? Are we sure that your dog or cat is not in pain and there's an arthritic issue present? It's hugely common. Probably, I think something like 80% of dogs over the age of 10 have arthritis and signs of arthritis, but 35% of all dogs have arthritis. It's not just a disease of old animals. It's absolutely something that happens in our kind of younger years as well. It often results from developmental problems with the joints, with poor conformation, which comes from breeding, which clearly is a problem that they're born with, and so is going to show itself and be present when a dog or a cat is younger. It could be joint problems. Have they had a cruciate ligament rupture, for example, which is very common in our dogs. But really, if we're not addressing this root cause, then our supplements, our pharmaceuticals, our behavioral modification strategies, they're only going to be acting effectively as a band-aid, and they're much less likely to fully resolve the situation or to resolve it to the best level possible, especially in the long term. And the sooner we get onto some of these other diseases, the better we're going to be able to treat them, the more successfully we're going to be able to treat them, because a lot of the long-term implications of these diseases haven't had a chance to manifest themselves. And so not only is your pet going to be mentally healthier, they're also more than likely going to be physically healthier as well. So they're going to be having a better quality of life and potentially as well a better quantity of life. We know things like arthritis, it does result in earlier euthanasia, earlier death than a dog without arthritis, or a dog with arthritis who is treated effectively also is going to survive, in many cases, years longer than a dog whose arthritis has only been possibly detected, or treatment has been started in the kind of later years when things have become really serious. So, with that in mind, let's switch topics to thinking about dealing with anxiety and fear at the vet clinic. There's a number of different things that we can do here. Now, all of those supplements, those other options that I've just mentioned, are absolutely appropriate here. We think of that as a pre-treatment kind of regime that is important. If we're doing that, if we need that, then that is done every time. It might be that once things are working really nicely and our other strategies are working, we can kind of dial things back a little bit, but we need to be cautious. We don't want to take a backward step and end up back at square one. We also need to be planning ahead of time. And here I'm thinking, letting your veterinary clinic know that your pet is anxious. If they're not already familiar with you and your pet, waiting in the car, calling ahead to making sure that your vet's not running behind and there's an extra long wait. Trying to book an appointment in the quieter times of the day. So that might be first thing in the morning. Some clinics, that's the busiest time because we've got all our surgical admits. So it might be just before lunch, just after lunch. Having that conversation and planning ahead of time. One really big thing that I want to speak about is needs versus wants. When I first graduated, going back a few years now, it really was almost a badge of honor to get any job done, no matter kind of what the reaction of the individual animal was. And I think it was actually also expected of us as vets as well, that no matter how wriggly and uncomfortable and stressed out our dog or cat was, if they were in for a nail clip, we were going to get those nails clipped. And if we couldn't manage that, then we'd have some pretty unhappy clients to answer to. Thankfully, times have changed. If our pets are really anxious, if they're stressed out, and it is a want, in that it doesn't matter if we don't clip those nails today, we can kind of abort mission, if you like. We can take stock of the situation. We can put in a few different strategies in place, and we can come back, the next day or in a week's time and have another go at clipping the nails. in a less stressful manner, hopefully with a much more calm individual. If we're dealing with a sick animal who needs a blood test, and the only way we can get that is through sedation, then that's clearly a need. We need to get this blood test because we've got a sick individual, and if we don't get that blood test, things could get significantly worse, and they may even die. That's a need. But like I say, there's ways that we can do that. It might be that we actually do resort to sedation sooner than we maybe would have done, when, again, back in the day, it might have been that all of the techs, all of the nurses just kind of piled on top of a dog and physically restrained them, so they were unable to wriggle, but they were not having a good time. No one in the clinic was having a good time, and that's really not acceptable now. So I think we need to be aware of that there are some jobs that we can delay without any impact, negative impact or otherwise, on a pet's well-being, their comfort, and their quality of life. And by doing that, by aborting, we're going to be much more likely to get a successful outcome the next time when we've implemented a few different changes. Now, some vets and most vets, or many vets at this current state of time, will be happy to advocate for your pet and will be happy to have that discussion with you. But I think as pet parents as well, it's also important to be aware that your vet may feel pressurized to carry out one of these jobs no matter what. And so you need to advocate for your pet. You can be telling them that, actually, it seems like, my dog, my cat is getting really stressed out now. I think we should pause. I think maybe I'm going to come back and make an appointment for next week. What strategies would you suggest we try to make it successful next time? Or what pre-treatment medications or supplements would you suggest is best for my pet? So really open up that dialogue with your vet. And then from a long-term point of view of helping your pet love your vet, we can think about a desensitization plan, putting steps in place where they're not needing to come into the clinic to have anything negative done, but having a positive experience, and actually taking the time to really be intentional about a desensitization plan really is time well spent. I unfortunately do time and again see animals that, haven't been socialized is the biggest one. They've never been to the vet clinic for anything but sickness or injury. So they're feeling, they're either feeling rubbish or they're feeling sore. And so that's what they associate their vet with. It's only natural. I frequently advise people to come in for socialization visits, and I'm constantly disappointed by how few take me up on that. And I also have it where I have patients that I really cannot get my hands on, and that has a huge impact on my ability to diagnose anything meaningful. It has an impact on a pet parent's willingness to bring them into the vet clinic because they are anxious and worried about how their pet is going to react, and that is only natural. And we know that this fear and anxiety and stress at the vet clinic, it does result in suboptimal preventive healthcare. It does delay diagnosis and treatment of medical issues. And this delay may even prove to be fatal. It delays healing of wounds after surgery. It can increase the cost of treatment because we're not able to, target our diagnostics most effectively, potentially. We might need repeat sedation or anesthetics, which are generally very, very safe, but may come at a greater risk, especially if we're dealing with an unwell animal. And ultimately, it impacts the health and well-being, and that can really be huge. And I believe this is a real, a real issue that not only should be addressed, but can be addressed. I've become Fear-Free certified. That's a qualification that kind of focuses on eliminating this fear, anxiety, and stress in all pets that visit the vet clinic. And, it's something that I feel very strongly about.
Helping your pet live the happy, healthy life they deserve.
And if you've got an anxious dog or cat, if you want to dive deeper into anxiety, I've actually kind of put together a web page for you with a load of links and different resources, specifically to tackle the problem with anxiety. You can head over to ourpetshealth.com/anxiety, or there will be links in the show notes and in the description to this podcast episode as well. So, it's a number of different free downloads. I've also got a course that I've produced to give you actionable steps in much greater detail to actually help your pet love rather than loathe their vet. And that, really is something that is not just possible, it's probable with just a little bit of effort and a little bit of intentionality and working with your vet as well. And then just before I go, if you've got any friends or family members that have an anxious dog or an anxious cat, if they struggle to get them to the vet clinic, I'd love for you to share this episode with them so that ultimately they can become happier and they can live a much better quality of life, which really is what I'm all about for dogs and cats, no matter where you are in the world and no matter what your situation is. So with that in mind, all that's left for me to say is that I'm veterinarian Dr. Alex. This is the Call the Vet show, and I'll talk to you in the next episode.
That's it for this episode of the Call the Vet show. Be sure to visit callthevet.org to join the conversation, access the show notes, and discover our fantastic bonus content. We'll see you next time.